Hello and welcome to an informational video provided by the Wisconsin Nurses Association and the Wisconsin Environmental Health Nurses Coalition, a mutual interest group of the Wisconsin Nurses Association. Today's presentation, Antibiotic Use in Food Animals, is presented by Dr. Kathryn Lammers and Jessica Adams of Winona State University. For more information on the Wisconsin Nurses Association and the Wisconsin Environmental Health Nurses Coalition, visit wisconsannurses.org.
Today, we're going to be talking about antibiotic use in food animals and the human consequences. I'm Kathryn Lammers, and I have been working in the environmental field for about 10-20 years and have a growing interest in presenting on the topic and involving my student nurses in the topic. Jessica Adams is here with me today. She's an RN to BS student with Winona State University and works at Gunderson Health in La Crosse, Wisconsin. Our objective today is to provide brief overview on an environmental risk.
80% of all antibiotics in the U.S. are used on factory farm animals for prophylaxis and to promote growth.
This animal feed, these antibiotics are just included in the feed even for the healthy animals. What we find is that it helps the animals to grow much bigger. The crowded conditioning makes poor hygiene condition. This is a common view of many commercial farms. According to the World Health Organization, the antibiotics may suppress certain susceptible bacteria that compete for nutrients with the host animal. With these bacteria gone, the animals can grow much faster and stronger. The more stress the animals are under, the worse the conditions, the better the antibiotics work. The antibiotics and other changes have promoted rapid growth in chickens over the last decades. We've shortened the time to harvest and increased the size of the chicken. Of course, there have been breeding changes that have happened to promote this larger size chicken.
The feeding of antibiotics in food animals is not sustainable for the future generations. Bacteria can mutate and turn resistant to the antibiotic. This puts humans at risk.
On this illustration, we're trying to just simply point out that as nurses, many of you understand this process. We have lots of different bacteria and viruses that are in the universe and in our body and in our animals. And when you expose antibiotics, we select for the superorganism and increases our amount of resistant organisms. As the drugs are used over and over again, we then have more MRSA or methicillin resistance organisms, and we also have vancomycin-resistant organisms. Overuse of antibiotics in food animals affects humans by getting into the food chain and getting into our waters and soil. When the animal has excrement, that becomes part of the runoff, which goes into our streams. Most farm practices prevent that runoff and have different standards for managing it. But it is a common area of concern. Also, the antibiotics get into your meats that you buy at the store. Some farmers do minimize the use of antibiotics and others do not.
At an individual level, nurses can know their farmers and know where their food comes from. Nurses can also be informed and learn more about the American farming practices. Nurses can be an advocate for healthy foods and advocate for people to be up to date with their immunizations. On a systems level, nurses can join professional organizations and advocate for hospitals to join or start green communities. This is a list of websites with the nursing communities that discuss how to be green in healthcare.
The American Nurses Association has a position statement on several environmental health issues, and one that you could be proud of. One states that antibiotic use should be limited in animals and that one strain of antibiotics should be reserved only for humans. And we're joined in that proposal with other partners that are professional organizations. The Wisconsin Environmental Health Nurses Coalition, which I'm a member of and have been for many years because I enjoy the camaraderie and learning from other nurses. You can get access to that through the website, and we use Pulse to stay in touch, which is a social media method. We have presentation and meetings at the annual conference in October, and every June we have a planning meeting. So if you would like to join the Wisconsin Environmental Health Nurses Coalition, we'd welcome you. Healthcare Without Harm is a major international website that has multiple disciplines contributing, and you would be able to find a great deal of information about many of the pollutants and toxins and pharmaceuticals in the water. It also has nursing work groups that you can join and a great deal of information about hospital-based practices that could be initiated. EnviraRN is actually called the Alliance of Nurses for a Healthy Environment. It's based out of University of Maryland, and it's a national program to bring nurses together on the areas of environmental health. Wisconsin Environmental Health Network has been another favorite of mine because it's Wisconsin-based, and it has an annual conference every February called Making the Connection. What I find is it's a very multidisciplinary professional organization that has a great deal of variety of speakers, and the Physicians for Social Responsibility have a strong presence, along with nurse midwives have a strong presence. And the Wisconsin Nurses Association has representation there. So I hope you would join us at that meeting. And then the last slide is on the references. We hope to see you on Pulse with the social media for Wisconsin Nurses Association. Thank you.